Hello, everyone. Thank you so much for being here tonight. I'm Liz Bridgewater, the Director of Outreach at Climate Action Now, and one of many people who work to bring this action party to you today. We've got a fun icebreaker question for everyone to answer in the chat. You'll see that pop up in just a moment. All right, that should be in there now. Our icebreaker this evening is, where are you joining from? And what's one small environmental or health habit you've tried to adopt lately? If you're feeling up for it, please also share your video so we can all see each other tonight. We will be recording this action party, and it will be available publicly online. We'll be sending out a recording tomorrow. If this is your first ever climate action party, let me give you a quick overview. An action party like this is an opportunity to learn about important environmental issues from people who are experts in their fields. In the course of the same hour, we're going to use the Climate Action Now Action Carousel. The CAN Action Carousel makes it easy to send well-researched, personalized messages to political decision makers and business leaders. To show you why it's so easy to take action with the CAN Action Carousel, I will share my screen for just a moment. All right, so this is an example action like the ones that you'll have access to tonight. It only takes 3 clicks to take an action. First, you click Do It Now. Then you just have to choose how you want to contact the decision maker that you're reaching out to. Because you'll have shared your address with the carousel, it will automatically know how to connect you to your federal, state, and sometimes even local officials. Then you just have to hit send and you've taken an action. As you take actions, you're going to earn points. When you earn enough points, Climate Action Now plants a real tree on your behalf. So far, Climate Action Now has planted over 400,000 trees together. Now let's go over to Kaylee Beam, Director of Content at Climate Action Now, to get us started with taking action tonight. Over to you, Kaylee.
All right. Hello, everyone. Like Liz said, I'm Kaylee Beam, Climate Action Now's Director of Content. I am just trying to keep my eyes on this chat, which is exploding with answers to our icebreaker question. So thank you so much for your participation. We've got using less single-use plastic. That's a great one. A few people approaching it from a dietary perspective, eating less meat, but also trying to reduce food waste through meal prepping. So that's great. Reducing dairy, and also people joining us from all over, which is awesome. It seems like we got a really engaged, amazing group of people. So thank you so much for being here tonight. And without further ado, like Liz said, I will get us all ready to take some action together in support of a safer and healthier future. So let me just share my screen, and you should be seeing that shortly. And there are already so many of you in here taking action, which is awesome. All right. But for those of you who aren't yet, as many of you already know, this is our goal tracker. On the left side, we have this cool little globe, which will fill in and iterate as we take action here tonight. But one thing that's a little bit different about tonight is that on the right side, we have a link and QR code, which will take you to an action carousel on the Climate Action Now website, like Liz was talking about. An action carousel like the one you'll be using tonight is available for any organization that wants to scale up their impact. You can get one embedded on your group's website in a matter of minutes. And we'll be dropping links later if you're interested in getting one for your organization. So for those of you who want to access the carousel on your computers, feel free to just type in that short link where it says shorturl.at. I'll also just drop it in the chat so you can click on it if that's easier. But if you prefer to take action on your phone, feel free to point your camera at that QR code box, wait for the little pop-up to appear, and just tap on it to get to the carousel. Of course, if you've never used the carousel before, you'll have to put in some basic information to take action, like your name, address, email, and personalized message. And for those of you who already have app accounts but are using the carousel for the first time, don't worry, you will not have to start from scratch. The carousel should recognize your email and prompt you to enter a verification code. And once you put that in, it will transfer all of your progress from the app to the carousel. And of course, for those of you diehard Climate Action Now app fans, you can still use the app to access tonight's campaign. Just go to the campaigns tab and find it at the very bottom under Protect Our Health. And one last thing before I stop talking, as you have seen in our advertising materials, we had a little help planning this action party. So I'd now like to hand things over to the wonderful Cornell University students we had the pleasure of working with this semester. So over to whoever's speaking first.
Thank you, Kaylee. Hi, I'm Camilla. I'm a junior in the Environment and Sustainability program. My chosen topic today was water pollution and access to clean and safe drinking water, which led me to create my favorite action, urge your city council members to promote the Chesapeake Bay monitoring cooperative cleanup and monitoring events.
Hi, everybody. My name is Gabriella, and I'm a junior studying environment and sustainability, specifically sustainable business. My topic of choice for this party was air pollution and frontline community exposure, which led me to my favorite action, which was urging your representative to support HR 566, the Cleaner Air Spaces Act of 2025, which funds clean air programs in vulnerable areas.
And hi, I'm Annika. I'm a junior studying environment and sustainability. And my favorite action was an action related to telling city officials to combat extreme heat by expanding access to cooling centers.
Hi, everyone. I'm Andrew, also a junior studying environment and sustainability. And my favorite action was one that urges the New York City Committee on Environmental Protection, Resiliency, and Waterfronts to advance a bill that would test for microplastics in drinking water.
Now we're going to introduce one of our speakers for tonight, Dr. Manasa Mantravadi, who is a practicing pediatrician, founder of Ahimsa, and national leader in food-based public health. She was named to Forbes Next 1000 and Inc. Female Founders 200 and serves on the AAP's councils on environmental health and school health. Dr. Mantravadi writes regularly on nutrition, prevention, and pediatric health innovation.
We also want to introduce Rebecca Brenner, who is a professor in the Brooks School of Public Policy at Cornell University. Her current research and practice include managed retreat and equity, environmental justice, bridging policy with science, and building disaster resilience within vulnerable communities.
Originally, Autumn Burton, Senior Associate of Climate Health and Environment at the Federation for American Scientists, was planning to join us as the third panelist, but due to an unforeseen circumstance, she'll not be able to join this meeting.
And finally, we'd like to share special thanks for our moderator tonight, who is Dr. Marianne Krasny. Dr. Krasny is a Cornell professor in the Natural Resources and the Environment Department, where she directs the Civic Ecology Lab. Dr. Krasny is also the volunteer director of food policy for Climate Action Now and is the reason why we're here with you tonight. We'll now transition to our panel discussion. Over to you, Dr. Krasny.
Thank you. And thanks to our Climate Action Now colleagues and the students who made all the actions that you'll see tonight and hopefully take tonight. And thank you to our panelists. So without further ado, I'll start with Dr. Mantravadi. And these are questions that the students have posed. And the first one I'm going to ask is, nowadays, companies often advertise their plastic products as green, quote unquote, or recyclable, quote unquote. How or are these products different from the typical plastic products, and are they better for our and the environment's health?
Hi, thank you for having me. Oh, hold on. I think it's to unmute my phone, not up here. So
It's
I apologize. So thank you for having me. It's so great to see so many people who care about the same things that I care about for my children and for my patients. A really quick background to what I do and where I came from to kind of frame my knowledge of plastics and kind of consumer products. I am a pediatrician by training, but in 2018, the American Academy of Pediatrics came out with a formal health policy statement on food additives in children's health. And in it, they discussed all of the environmental toxins really for the first time in our academy, a group of 67,000 pediatricians, talking about the harmful health effects of plastic and a lot of other environmental toxins. So in 2018, it was really the first time that pediatricians were coming forward to talk about environmental toxins and the relationship to children's health outcomes, which is pretty powerful. And so in it, they recommended to avoid using plastic to store and serve food and rather use glass or stainless steel. So, unfortunately, if you have children and have ever been in a Target, for example, there are baby bottles and dishes and children's toys that are mostly plastic. And so we'll get to why that matters later, but that's kind of how I entered the space of consumer products. I launched a company that is a line of stainless steel dishes for kids to help parents actually follow these health guidelines. And so that's kind of where my knowledge comes from, is bridging clinical medicine now with manufacturing and business and consumerism, and where that kind of intersects with policy. So now kind of being in the business world, what do brands do? They do a lot of marketing, and part of that is labeling things green and recyclable. And so we have no plastic in our products on purpose, whether it's our packaging, and certainly not in our products, but there are a lot of brands out there that do. So when we think about recycled plastics, those are the codes 1 through 6 that might be familiar with, but probably many of you know on this call, less than 10% of the world's plastic is actually recycled. And then those green plastics, like bio-based plastics, biodegradable plastics, they often fail to degrade in our natural environments, like marine or soil settings. And some of them aren't even biodegradable. So even though the plastic origin might not be from fossil fuels, for example, it doesn't determine its toxicity, its persistence, or its health effects. So I think it's really important to understand that there are real health impacts related to the different types of chemicals in plastic that we can talk about. But the average consumer doesn't know that. Like, you all are more aware of that because of what you're studying, but the average American doesn't understand these nuances. The other aspects of these, what we call like greenwashed or bio-based plastics, there's often additives. So things like phthalates, bisphenols, flame retardants, UV stabilizers, all of these things, colorants in children's products, for example, they're all added to plastics, including bioplastics. And remember, those additives are often the drivers of toxicity. So things like endocrine disruption, metabolic dysfunction, neurodevelopmental effects. So it's not as easy as saying the bio-based plastics are actually better. So overall, perhaps they might have some marginal impact on environmental benefit, for example. But when we really think through the upstream kind of toxicity and lack of regulation of those additives, real ability to even, reuse these products, it's kind of like net negative still. So I think when I think about environmental health, we think about the effect on the planet. But then as a pediatrician, I think about the effect on health. And a lot of our success with having a consumer-based product is driving behavior change that actually leads with health. And that's what we've kind of seen, whether it's in children's products or within schools. Oftentimes what we find is that this sustainability is abstract, it's long-term, and not everybody can really wrap their brain around it. When we tie environmental health to true health, human health, suddenly people kind of listen and are a little bit more inclined to make decisions because it's their child, it's present right now, it's immediate. So that's kind of, hopefully that answers the question on really, are bio-based plastic, plant-based plastics better? Maybe marginally for environmental impact, but from a health impact and toxicants, the answer is no.
And I'm sorry to cut it so early in the discussion, but we have already blown right past our initial goal. So great work, everyone who's taking action. Keep it up. I'm going to go ahead and bump it up a bunch, I think, to 500. So keep taking action, get us to that second goal. And thanks so much. Keep up the great work.
So thank you so much, Dr. Mantravadi. And I just have a follow-up question. Just because I thought when I was reading your bio today, I thought it was fascinating. You had started this stainless steel, I guess glass also, but I noticed stainless steel products for children's lunches and so forth, because I'm visiting my granddaughter now in Denver. And when I dropped her off to school, her parents do use the stainless steel lunchbox with the little stainless, it's very cute. And, but I didn't see any other in the sort of pile of children's lunchboxes there on the shelves. So is the market taking off? How do you market this? It seems like, for example, Montessori schools might be a great place to market this. There's probably so little awareness amongst parents.
There is, it's interesting. So in general, what I always think about as a clinician and scientists on this call, budding scientists, when we have research from a lab and it sits here, or we give clinical medicine and it's 1-to-1, in our clinics, both important. But if those are not integrated into real world application, then actually the science is just sitting in a box by itself, or sitting in a box. And so the reason I designed this is, here we are, American Academy of Pediatrics, with a formal health policy statement on plastics and the formal recommendation to use glass or stainless steel. That's great medical advice based on real science in a laboratory. But if parents, right, and schools don't have a solution to follow those medical, it really is not solving the problem. And so when we look at market shifts, most of these products designed for children are made of plastic. Why? Well, guess what? They don't break. They're colorful. They're cheap. All the reasons that makes a great product for kids are all the reasons that makes it horrible for their health. And the market is currently saturated with plastic products for kids, based on cost, convenience, all of those things. And so when we try to introduce new solutions into a market, it is hard because it takes so much education of the parents. And what I can tell you is, in my experience as a single pediatrician, or even, in the environmental health space, you can talk and not everybody listens, but then somehow you have a product and everyone listens. And I think that's really important, actually, for everyone to understand that big business can actually drive social change. And while I had to take a while to wrap my brain around that, it is an important thing, because when you give consumers or the public a solution that is easy to implement, when you do that, you're serving information on it, right? So this is the chance, like when you do that, to be able to talk about endocrine disruption. You can carbon emissions and plastic as they're producing products for kids. Suddenly now they're interested because they have this. I think that's a really important part of this mass kind of change. We can't sit in our silos of, laboratory bench research, clinical medicine, policy and advocacy, education, business. Like, it really is the intersection of all of those that make these changes scale faster.
Thank you. Yeah, I really like that quote that you have a product and everyone listens. I think that's a good way to think about change. So, okay. So thank you so much, Dr. Mantravadi. I'm going to switch over to Professor Brenner now. And the first question for you, Dr. Brenner, or Rebecca Brenner, is that a lot of your research focuses on community resilience to climate disasters. What can communities do to build public health resilience in response to climate impacts? And also, when I was looking at your bio today earlier, I saw that you'd won an award for the work that you did locally with a low-income community in Ithaca, where you're trying to build, I guess you call them resilience hubs in disaster. But what it didn't tell was, because you had a lot of community meetings to decide what those hubs should look like, what the community decided. So I think that's very relevant to this question.
Yeah, and thank you so much for having me. And it's always great to work with you as well, and happy to be here. So actually, it's a great way to talk about is the work that we're doing with resilience hubs. And I'll say that to back up just a little bit, that we're seeing major shifts happening with extreme heat, flooding, and different climate systems. And there's really a big range of impacts. And we're seeing this all over. And we just don't have the world doesn't have the capacity to know that when these climate shifts happen and there are these extreme climate events, for the all the fire departments and the ambulance and everybody to come, even though they're wonderful in what they're doing, to have the capacity to manage this level of what disasters we're kind of expecting, knowing that we're having these big shifts coming. And so what we've been looking at is trying to understand what are the capacity of community of different organizations, nonprofits, community centers, and what they can do to build and invest in their own resilience so we don't wind up with a situation like we did with the Superdome from Hurricane Katrina. And that's what people have been planning for, is that, somewhere there is some evacuation plan to anybody who doesn't have someone to evacuate to will evacuate there. And what Resilience Hubs is very, very different. And it kind of takes a very different approach. And this is what I've been really, really working on, is understanding what is the capacity to manage within that community and invest in those. And to do that, we need to understand what people are exposed to, where they're having different sensitivities, and that's different household to household. It's very hard to make generalizations, even though that's been what a lot of pressure has been to be doing. And so we know we have these climate shifts in climate, and we have this range of impacts. And so what Resilience Hubs, and this is what I've been working with Southside Community Center, the Paleontological Research Institute, and the Same Reaches Mohawk Tribal Nation as 3 different entities on the first round of trying to learn what we need to do for each one of those entities to invest in what their people within their community are exposed to, and what is needed, but also what is the capacity of the different organizations to support those individuals. So Southside Community Center is an amazing nonprofit here in Ithaca. And what we found out in 2022 is FEMA rezoned their flood maps and said, okay, and this isn't made up, like flooding is going to happen. Like we can see that flooding is going to be an issue, but when they rebuilt all their flood zones, that community, that's a long-term, a community that's been there for a very long time, is now in this flood zone. And what that did is it added this major homeowner insurance. And it became such a high cost that people would be just displaced from that community. And then, so there's first that problem where if you have that displacement, then people lose social cohesion, and those bondage and bridges that they have in these networks are what helps build resilience within community, is that social cohesion. So that was one. And then the next thing is that this area will likely flood without intervention. And so people are at risk of being hurt or losing their home, or and not know where to go. And so we've been working with Southside Community Center and these other organizations to understand what capacity is within their capacity to be a resilience hub, so people can go there. And it can't be everything, because they have to still maintain their mission. Like Southside Community Center is an incredible resource, and people rely on it for a number of things. They can't just not do that mission anymore because there is a flood. And so what we're trying to do, me and my co-PI, is we've been working with these different communities partners, and we're actually building a workbook, like a playbook. So because not every entity is gonna meet a faculty member who has a group of students who can give that kind of capacity. But so we're writing a workbook with these entities so that they can define for themselves where they're exposed, what they're sensitive to, and then how they can make investments over time for people within their community, where they can still maintain their mission and vision of that organization, but then as well invest in that region. And so that Southside Community Center is in this flood zone. Then we've been also working with the Paleontological Research Institute, which is also in this region, but up on a higher elevation near the hospital, but also sits in a location that wouldn't be flooding at all. It would be other climate risks and disasters, but they as well have limited resource. There's a limit to what entities can do. And so it's going to look different for them and what their needs. And then we have a partnership with the St. Regis Mohawk Tribal Nation, which actually is in the north. It's Adirondack Park and really far north, and it sits on the St. Lawrence River between the U.S. and Canada, and is between those two. It's its own nation. St. Regis Mohawk Tribal Nation is its own nation that sits between those, and they have an incredible department of their own version of the Department of Environmental Conservation that's for their own nation, and they make great investments in their own resilience. And all three of these entities we've been working with and really more listening on what they would need in creating this playbook so that we can give it to any entity in New York State. Now, resilience hubs is something that has become a little popular within very rich, wealthy urban areas that can make investments. And what we're focusing on is this kind of rural urban fringe where people are being displaced to as people are getting moved out. There's gentrification happening for a number of reasons, which is really hard. And people are getting moved out to these areas that historically they've had social cohesion with, and then they're getting to a place where they're in this urban rural area where different households may have relied on emergency responders, and now that social cohesion needs to be built, or in very rural areas, which would be totally different. And so we've been working on this for about a year with Southside Community Center and these other entities. And then we're testing the playbook out right now. And then we're going to do a whole nother round with a whole another level of nonprofits and community organizations to test out this playbook with the ultimate goal of anybody really being able to use it, whether it's for 3 people or 3,333. I don't know, making up numbers, but really it doesn't matter. But it's more for them to understand what investments they could take when some entity finds that their area is going to flood, or there'll be extreme heat, or there will be drought. What do you do with that information? And how can you set yourself up to build resilience? There's no magic solution. Every place and space is different. And this lets people self-identify rather than being told what to do. They can make those investments. Is that clear? Did that come out?
Yeah. Thank you. Thank you.
Not
So
to
you're
cut
still
in again, but we have once again exceeded our goal and exceeded my expectations. Great work, everybody. I'm going to go ahead and bump that number up to 750. I think we can get there. We still have half an hour, so keep up the great work. Thanks, everybody.
great. Thank you. And yeah, thanks, Rebecca. And I think that the issue, it's such an interesting question of like, how can a community plan for disaster and make sure they have the infrastructure that works for them, I think is what you're saying. So thank you. I'm going to have a general question for both of you in a second, but Dr. Mantravadi, is it possible to put the link to that resolution from 2018 that you referred to in the chat? Because somebody asked for it and probably others would be interested. Thank you. Okay, so as you're doing that, I will do the question. Can you listen to the question at the same time? But we'll have Rebecca go first. Okay. So given that 4 Cornell students designed the questions for tonight, there's a question that goes like this. What role do you believe youth activists and young professionals will play in shifting public perception and driving environmental health solutions? So we have like 14 questions. So if you guys, if you can be kind of brief or succinct in your answers, but having said that, I would say a lot of people on the call are not youth and are more third act type age. In other words, retirement age. So, you could, I don't know if you see something different for youth activists and young professionals versus retirement age people. So, Rebecca, you want to go first?
Sure. Sure. There's so much to do. this organization and what you're doing right now in climate action, what a lot of people want to do is they need to know what to do. I think a lot of people want to help and they don't know how. So this is a wonderful resource, and I would lean into this for sure. The other thing I think both young and old alike, and every age within who want to participate in understanding climate health solutions and public health is two things. One is I spent a long time trying to not just talk to the people who you agree with, but try to make sure to talk to people you think may not share similar ideas, and make sure that if we come up, we have, I don't want to be too gloom and doomy, but our climate systems are shifting and people are really at big risk. And public health is another layer to that. So when we see things like extreme heat, for public health, that puts a lot of people that are going to be at risk. And so talking and understanding what the challenges are that they're facing and listening, and then volunteering and looking for opportunities to invest in coming up with the solutions that really that are affecting those particular communities. And I think what I keep seeing over and over again is that people want to know, what's that one thing that I can do? And there really isn't one thing, and every place and space is going to be different. And really listen to what the challenges is that community is facing, and then commit to invest the time to do that. And one thing that I like to also do is think of things in like 15, 15, and 15. What can I do in 15 minutes? What can I do in 15 days? What can I do in 15 months? And because you can do a lot in 15 minutes, really, and it's really important, but it's you can do something different in about 2 weeks, which is about 15 days. And then in 15 months, it's over the course of a year. So like in 15 months, you can start to show up at public meetings, listen to what's happening, and then start to make proposals to policy investments. I'll pause there because you asked us to keep it short, and I'm not great at that. So, but
Thank you. I love that 15, 15, 15. Okay, Dr. Mantravadi.
So I believe in the power of everybody's voice. As a pediatrician, I really believe in the power of young voices. And here's why. We got here with our climate situation because of human behavior, period, right? Like that's why we got to where we are. And the only way to undo it is human behavior. That is the solution. So it's our individual actions, it's our group actions, and certainly community and policy actions. What is really refreshing about where we are in this current period of time is, we used to make a lot of changes when it was like you had to go to the government and policy change, and it just took so long. And once that changed, then there was a long, arduous process of like downstream change of whatever was going to happen, right? And now the consumer, the person on social media, the K through 12 students, the young professionals, you can all communicate with each other. You're making purchase decisions. You're making daily habit decisions based on kind of this knowledge and access at your fingertips. And why that's exciting is that, I saw a lot of the answers that you're, I'm going to eat less meat. I'm going to reuse something. I am going to X, Y, Z. Now, when we have individual behavior change en masse, that's how we actually fight climate change. That's how we get back to a healthy state where, in my field, we're not giving kids a bunch of ultra processed food served in plastic filled with toxins, right?
Mm-hmm.
Actually, again, going backwards in time and cooking fresh meals, that we're washing dishes in schools and not using single-use plastic. So why I feel really refreshed about this question is like where, what does the youth hold? I think it holds everything. And not that the third act can't change. It is harder to change habits later in life. It is really a great chance for humans to change behaviors at younger ages. So whether it's kids, college students, young professionals. So that cohort of people can make individual changes that can impact the world when we're all doing it together. And then secondarily, that you have so much more connection and voice, like you have voice with your wallet, the amount of, healthy, clean brands that are out there that people are purchasing. So it's shifting the market that way. The number of organized kind of community events like this one is shifting the conversations towards policy changes. So for all those reasons, I think a lot of the power is within you. I think people like us have to continue to support and not stop the fight. But I think for those reasons, I'm very reassured in the direction that we're going. Because at the end of the day, it's behavior change, behavior change, behavior change to get out of this. So, and we can't wait for the government just to change. It's like we have to force that hand by mass behavior change.
Thank you. Thank you.
I
Okay.
promise this is the very last time I'm going to cut in. I'm just going to bump up our goal one more time. I feel like it's perfectly timed with when we finish a question, but great work reaching our goal again, everyone. I'm just going to bump it up one more time. Let's say 900, and then we'll see how many we can take by the end of the hour. So thanks so much.
Thank you. And I'm going to follow up with another question for Dr. Mantravadi. And that is, and I think the question will be slightly different for Professor Brenner because the agency might be different. But the question is, how have environmental health discussions changed with a new head of the Health and Human Services? Have you noticed an increase in public health misinformation under the new U.S. administration? And what advice do you have to control the spread if you do think there's misinformation?
Oh boy, this is a big one. I have lots of opinions as a pediatrician and as a mother. And so here's where I stand with these things. I think that when we can talk about topics without political affiliation and really, again, this comes back to behavior change. When we can talk about a singular topic that everyone is really rallied around without political affiliation, we actually can start to see that we have more in common than we have different. And here's a perfect example. Food is health, right? That is my entire kind of where I live right now. Food is health, food is medicine. And that's our food system is a great intersection of environmental health, human health, policy, consumerism. It's like a great, single thing. And why I say this is there a lot of misinformation? Yes. Is there a lot of discussion about things that are important? Yes. That the conversations are going. And why I say that's important is when we talk about something like the food system, for example, in the clinical world, this is the first generation of children who have a shorter life expectancy than their parents. Like in the history of humanity, this is the first generation of children who have a shorter life expectancy than their parents. And so when we think about what that means, the discussion on chronic health conditions in children is important to bring to the forefront. That is happening. Our concentration has been a lot on treatment of these conditions that have skyrocketed in both adults and children. So the conversation has shifted more upstream to talk about kind of the preventative natures, the environmental toxins, the things that we can do upstream. And so I think that's important because as I started the talk, when we're in our silos as a physician, if we're only just ever talking about treatment, American healthcare system, for example, is talking about treatment as opposed to look at all the exposure that we are exposed to on a daily basis. Look at what the behaviors we do then emit carbon emissions that increases the risk of asthma and incidence of asthma in children. Those are important to start connecting the dots. So I think it's important that the discussions are happening and that we are connecting the dots with human health, planet, behavior, and kind of connecting those dots now. And I think that doesn't always go in the way that I certainly want it. That being said, the fact that it's even, in the masses' eyes is an important it's an important moment because I think everybody can rally around, oh yeah, food is health, children are important, school lunch is important, the planet's important. But when you kind of separate all those, you can't actually help an average person tie those things together. So I think that when the discussions are happening, people are more likely to connect the dots and make those small behavioral changes that are incredibly important. So I think that, environmental health and should be a part of like HHS conversation. And I think historically it's not because our health system in America is so focused on treatment. So let's clean up the oceans and let's put people on medicines. It's like, oh, or you could reuse and not even generate the trash in the first place and cook healthy food to prevent the downstream kind of chronic condition. So I think for those reasons, I do think it's important that we have those conversations and connect the dots for the masses.
So what I hear you saying in brief is that there's actually some good coming out of the new head of the Health and Human Services, because at least we're raising some issues for discussion.
We are raising, and to Rebecca's point earlier, it is important to have different perspectives and listen to each other, because listen, it is important to hear the science. It is also important to hear what that mother might be going through. To raise a healthy child, like if she doesn't have access to healthy food or safe materials or a community that is not filled with pollutants, like we need to hear that. Like we have to understand all of those things. So I say it with a grain of salt because but it's important that the discussions are happening. Yes.
Thank you. Okay, I'm going to turn to Rebecca. And for you, it seems like what I'm really interested in, since you've been working on the resilience hubs and the idea of resilience, if we have an administration that's pretty much denying climate change, like, do you see any impact on a local level or a state level in terms of communities' ability to build resilience hubs or build resilience more generally?
I think it's a really great question, and I really I think a lot about when you're talking about, but there's a couple things. One is this concept of trust, right, and misinformation, and I think we're in this place where there's a lot of people. There are definitely people who are very polarized in how they think, and then there's a lot of people who are really scared because things that they've commonly held before are now being challenged. And I think trust takes time. And I'll share with you that I have in around 2019, I started to work with this community called New Lebanon, New York. And so we're in Ithaca, about 3 hours northeast is Albany, which is our government seat. And New Lebanon is a rural community adjacent to it. So it's a community there, and it's very polarized with people who were politically very, very polarized. And so taking it out of this current administration, but looking at a place that already had that major polarization. And one of the things that I was looking at is that I looked at this map that New York State has this awesome program called Climate Smart Communities. I love it. And what it is it's super cool, where a community can become a climate smart community. And if they do different actions, they get certain points. So like they can put recycle bins in their town hall and they get 2 points. And then when you get to a certain number of points, you get bronze, and then you get silver, and then you get gold. And then once you get those different levels, you get access to other kind of funding that you can continue to invest in your resilience and work with the state of New York. And then other states around the country have different versions of it. But what we were seeing, if you look at a map, it was almost like you could almost draw political lines of who was participating and who wasn't. And so we started working with this town, New Lebanon, that was very politically divided. And the thing that we started to do was really listen and say at first, what is something that we could do on this huge list that isn't politically divisive? and that is something that we can all just agree on. And you know what it was bicycles. Was that there were so many, because I'm a mom and I can't believe how quickly my kids grow, and then I have to buy them a new bicycle. And I love bicycles because they're great, efficient machines that get you around and you're not contributing to impacts. And in fact, my partner bikes to work every day here, even in the snow, which scares me a little bit. But so what we did is we worked with this bike share program, and then all of a sudden it was this safe space because we weren't talking about things that were this, that, or the other, but we can identify things that contributed to a healthier, cleaner environment that also met these climate smart community action goals, but weren't politically divisive. And the things that were politically divisive, we were like, we're not going to talk about that yet. And now that we started that partnership in 2018, 19, and now here we are in 2025, where because we've built trust, we now can start to tackle those different things that were originally politically divisive. And trust takes time. And so now if we have a current administration that's doubting and questioning and all these things, and there's misinformation, if we make the investments to build trust and say, look, if this is something we can talk about, let's put it over there. But let's find the things that we can talk about, build trust with each other, agree that there's going to be things that we don't agree on. But ultimately, we need to make the investments to have people be safer. And I will also say that we're also getting to a point with our climate and where I used to try to convince people that climate change was happening, and we're not there anymore. And at this point, when you look around the world, you see what happened in Texas with the freeze, and you see flooding that's coming in I mean, I'm sure everybody on this call can find those different pieces of things where we are beyond exceeding any sort of climate and impacts. People are aware that they need to prepare themselves for what's happening. And I guess personally, what I'm trying to do is not, if it's something that we are disagreeing about, then I think right now we need to invest as quickly as we can in building trust and social cohesion, and agree that there's going to be things that we disagree about, and then over time can make those investments to have a more resilient future. And I wanted to add one other thing and to lean into is as a parent, I find it's also really, really important. Like I happen to be vegetarian for most of my life, but just being a vegetarian doesn't mean that I have no impact, because I could make choices that are shipping things in from all over the world, and I could, and so I think modeling that kind of behavior is really, really important. So it's not just about talking about these things, but also modeling that behavior and visibly making those decisions. And I see my kids, if they see me do it, are going to act differently than if I just tell them.
Yeah.
I'll pause
Okay.
there.
Thank you. Okay. We have about 6 more minutes left, so I'm not sure if we have one or two more questions. But there's a bunch of questions that the students came up with that have to do with how do you integrate environmental health and public health, either on social media or through advocacy. And I think you both mentioned what I find very interesting is physical objects, whether it's the lunchbox, the stainless steel lunchbox, or whether it's the bicycle, that are ways of actually integrating public health and environmental health. So do you see, maybe more abstractly, a policy that you think is a really good example of this, or maybe a social media site or a writer or somebody who's doing a really great job of that we might want to look to further? So we'll start with you, Dr. Mantravadi.
I think so there's a lot of great resources there, and I think in general that's what it always comes back to, is behavior change. And who's great at change, who are great change agents? Social media and organizations. So I think there's a few that I really love in particular. One organization is called Upstream. They are agents of change very specifically on reuse. I think reuse is a very specific behavior change that that people can do, right? And so you can do that. I mean, I have patients who have, who are attending private school, and then children who are their parents are working 3 jobs and on SNAP and are enrolled in free and reduced lunch. So, but all of those people, right, no matter where you are, can make one small change towards reuse. So that's like a very specific behavior change. So that's why I really like that organization, any organizations around reuse, because it's a simple one to do. Not everyone can buy an electric car, not everyone can, but these are like these simple things that people can do. But what I think is important is that behavior change through organizations or through social media influencers or through even what we see on TV, modeling, instead of using a plastic a plastic bottle, water bottle. I work with the Plastic Pollution Coalition. They're another great organization who do a lot of great initiatives. And they had one which was called Flip the Script in Hollywood. So, and it was a very thoughtfully designed campaign to make sure TV shows and movies were modeling reuse as opposed to the characters on TV drinking out of a plastic bottle and throwing it away, that they were constantly reusing items. And so that is one way that kind of this more social impact starts to change behavior. But the flip side to it is you have to have infrastructure change for that to happen. We see that in airports now, right? There are water filling stations. That wasn't even there 15 years ago. It really wasn't. Those kind of things. And we work in school lunch. Most American school lunches are using single-use plastic every single time. We are teaching those children to use something for 15 minutes and then throw it away. So talk about modeling, Rebecca, right? Like it is, we are literally teaching them in the place of their education to use something for 15 minutes and throw it away. So, but those schools have to have infrastructure changes for reuse. So if they don't have a dishwasher, if they don't have that infrastructure, if they don't have the staff to help wash dishes, it is impossible for the school who wants to make that change. So I say that with a caveat because even something as simple as reuse, even though people can do it, we need the support, the infrastructure, the funding to be able to do it as a society. And that is, everything from the water filling stations, brands actually coming out with better for you products, things of that sort. So that's kind of where, like, I see, agents of change is really, again, the intersection of nonprofits, of social media influencers, of politicians, of physicians, clinicians. Like it's not just like one agent of change. It has to be all of
them. And the individuals that kind of are changing the behavior then force the others, companies or whomever to. So yeah, it's a big inner network, it seems like.
It is. And I will tell you, being on both sides as again, like the faster change, and I hate to say it, but it's just true. The faster change does happen on social media. And the faster behavior change is happening on these platforms. That can be positive or negative. So if we can skew it towards positive change, and the faster change that people can do are those decisions in their daily life, which that they purchase. And then we kind of speak with our wallet and speak with our behavior. That's actually what changes the market and changes the policy. Like, so a lot of times those policies come from the demand of the consumer.
Right. Yes. Thank you. Great contribution. Thank you, Dr. Mantravadi. And Rebecca, we have about 1 minute left before I think Brett wants to come in and wrap it up.
I want to just reiterate reuse because I'm in the same, and I'll do this in a minute, but I'm in the same boat where I would say that I only buy reused clothes, and I have for a number of years now. And I think it's really important, but it's not just that I buy my own clothes reused and other things reused. But it's really important that I share that, because when I'm in a position of power, like standing in front of a classroom of students and say that I'm buying reuse, then I'm taking that and getting and saying, look, it's okay, and not only okay, but this is a professional thing to do, because there is that stigma. And the other thing that I'll say really quickly is to invest in farm shares and local foods, and get a CSA, a community supported agriculture. And we have wonderful ones around here and all over. And so not having the shipping and transportation with food is really, really important, and things that you could do in just a short amount of time. But I'm all for reuse. I love it.
Okay, thank you. Thanks so much. I'm going to turn it over to, thank you so much, Dr. Mantravadi and Professor Brenner. Really, really interesting discussion. And it looks like I'm turning it over to Brett Walter now.
But before Brett jumps in, I just want to celebrate all of you one last time. We almost hit 1,000 actions, which is incredible. We cleared our goal several times, so you're all awesome. Thank you so much for advocating for a livable future for everyone. So we just really appreciate your participation in this call and for being here. So now over to you, Brett.
Yeah, and thank you again to our wonderful panel. Great information and great discussion, and especially all of you, who are out there participating. I know some of you probably didn't have the opportunity to take actions in the carousel, and that's okay, because I can't multitask. I could take actions or I can listen. I really can't do both. But I wanted to kind of share with you a mind-bending fact. There is a really wonderful research organization. It's called the Yale Program on Climate Change Communications. And they've been doing surveys of the American public for decades on American public attitudes about climate change. And they've found it's the percentage of Americans who are concerned about climate change, very concerned. They break them into different categories, but the category of people are very concerned. The word they use is alarmed about climate change. It's about 28% of the American public. Now, that's about 70 million adults. And by alarm, these are people who know climate change is happening. They believe it's serious, and they believe it is impacting or going to impact them personally. Okay. Now, the majority of those people, this is the mind-bending fact, are characterized as willing alarmed. There's a group that's our active alarm. That's people like you who are on this call. You are active. But there are more people who are willing alarmed. And willing alarmed are people who are very alarmed, but they do absolutely nothing about it. I mean, think about that. They know this is serious and they do absolutely nothing. And that's like 35 million people. So why do they do nothing is the question. And the answer that the Yale program has come up with is twofold. One is that nobody's asked them to do anything, but more importantly, nobody has made it easy for them to do anything. This action carousel that many of you were using tonight, this completely changes that. Because if you used it, you saw how easy it was to take an action. And as your panel was saying, putting it out there, expressing your opinion, telling your elected officials and business leaders, that you want action, this is hugely impactful. It's hugely important to people, and it's so easy to do, and it's so rewarding with the carousel. So that's my build up to my final request of you. This action carousel can be put on any website in a matter of minutes. We will give any organization that wants an action carousel, we will give it to them. 12 lines of HTML, they can embed it on a website in a couple of minutes. It's totally free, and it will escalate the number of people in their world taking action exponentially. So this is absolute. We've demonstrated this again and again and again. They'll see an exponential increase in their impact. So what can you do about that? Well, if you probably belong to some local groups, you probably belong to some nonprofits, ask them to get the carousel. Now, Liz is going to put some links in the chat that will give you information, boilerplate texts that you can send to leaders of organizations. links to the sign up form on our website where people can just come in and say, here's my organization. I want an action carousel. So we just have to get the word out there. We need to activate the willing but inactive people who are very alarmed about climate change. And that even among the 30 million or so who are active, they're not doing nearly as much as they could because they're using the old-fashioned, outdated advocacy tools where they only take 1 or 2 actions a week. So this is a great innovation. It's available for anybody. Please help us get the word out. And thank you again, everybody. Fantastic panel, great discussion, super important topic. Was there any last thing, Liz, or is that it for us today?
I just want to say thank you as well for everyone joining in the audience. You're really the glue that makes all of this work. None of these actions would do anything if they were just sitting in the carousel. So thank you so much for showing up. That's the hardest part and the most important part. We really, truly do appreciate that. And for our panel and planning team, I think we'll now open our panel breakout room. That's just for the folks who were speaking or planning the event for a little bit of debrief and decompressing. Otherwise, we're all wrapped up for the evening. Thank you so much, everyone, for being here, and we'll catch you at the next action party. Have a good rest of your night.
Bye.